I'm now going to present to you cultural and linguistic competence frameworks. The first one I'll present is addressing a definition of cultural competence, and it was developed by Terry Cross, Barbara Bajoran, Carl Dennis, and Marisa Isaacs in 1989. It was initially developed for children's mental health, and we've used this definition and have modified this definition because we find it almost universally applicable across multiple systems of services and support because of the principles, the general practices, and the structures that are offered within this definition. So we're looking at cultural competence as requiring organizations to have a defined set of values and principles, and they must be able to demonstrate behaviors, attitudes, policies, structures, and practices that will enable them to work effectively in cross-cultural situations. And I want to highlight behaviors, attitudes, structures, practices, and policies. We're looking at defining culture as an integrated pattern of human behavior that includes a wide range of things: thought, communication, language, beliefs and values, practices, customs, courtesies, rituals, manners of interacting, roles and relationships of a political group, a racial group, an ethnic group, a social group, and or a political group. We know that culture is indeed dynamic. It changes from generation to generation, although there are certain aspects of culture that clearly remain the same and may be, again, passed down from generation to generation. And so, again, this definition of culture is very broad. It exceeds way beyond looking just at race and ethnicity. This is a really nice quote. It's from the early childhood literature, and I think it gives us a really good picture, again, as we think about culture. Culture is akin to being the person observed through a one-way mirror. Everything we see is from our own perspective. It is only when we join the observed on the other side of the glass that it is possible to see ourselves and others clearly. But getting to the other side of the glass presents many challenges. And as we think about cultural and linguistic competence, this quote really resonates because it is very difficult to see perspectives other than our own. We're also going to share another idea about culture, and this is called the iceberg concept of culture. And the graphic really relates an image of an iceberg with the tip just above the water and a lot surface beneath the water. And as we think about culture, many people pay attention to things that are above the surface of the water, things that are readily visible, such as how someone may dress, they may guess someone's age, they may look at physical characteristics, they may look at gender, they may hear how someone speaks, and perhaps make some assumptions about that individual. But as we think particularly about health, and we're thinking about health promotion, training, and trying to change those behaviors, what's very important is what may be underneath the surface, things that are not readily visible. Again, looking at perceptions of health, illness, disability, looking at who makes decisions within families. Again, looking at decision-making processes, et cetera. All of these things are very, very important and must be taken in consideration as we're thinking about designing training and health promotion activities. The term competence, as used in this definition, really requires values, attributes, knowledge, and a skill set to work effectively in cross-cultural situations. Again, what's very key as we think about competence is that there are lots of culturally hyphenated words. We sometimes hear culturally sensitive, culturally aware, culturally appropriate, lots of culturally hyphenated words. We think they all mean something different. This term competence is really talking about changing behaviors, because that's very, very, very key. Just because I'm culturally aware doesn't make me do anything different in how I approach training or how I design materials. And so competence is really looking at the values, the attributes, knowledge, and skill set, and how you change behavior to achieve a different outcome. So if we think about cultural competence within an organization, there are 5 levels. First of all, there must be the ability to value diversity, and that means in all aspects of the organization. Oftentimes people say they value diversity. We may see it on their brochures. We may even see it stated quite clearly in their mission and vision. But when you look overall at the organization, that diversity is not indeed reflected. So we're looking at not only valuing it in terms of what we say, but also in how we behave and what we do. Another element of cultural competence is the ability to engage in cultural self-assessment. We see this at an organizational level and at the individual level. It's the ability to look at yourself in space and time to see what your strengths are and what may be your areas for growth in terms of how you provide services and or develop and provide training to diverse populations. Another element is the ability to manage the dynamics of difference. And really what this looks at is when people come together in any situation, be that within an organization in terms of colleagues, and or when you bring many different people together for a training event or for a workshop. It's very important to understand that there are dynamics of differences, that two people indeed from many different cultural groups may come together with very different beliefs and practices. How do you begin to address those within the context of your training? Another is looking at acquiring and institutionalizing cultural knowledge. And generally, what does that mean? That really looks at the extent to which an organization is able to learn many of the cultural factors, many of the beliefs and practices from a particular group, understand those, and be able to share them across the organization so that those working within the organization in particular would be able to meet the needs and address the needs of this population in a most effective manner. Lastly, an organization must be able to adapt to the diversity in the cultural context of the communities that they're serving. And this will be through the policies, this will be the structures within the organization, this will be in terms of the values and the services that are indeed designed. It's important to think about those elements at every level of an organization, starting at the policymaking level, down to the administrative level, the practice and service delivery level, at the consumer and family level, and at the community level. And again, these elements must be reflected in the attitudes, the structures, the policies and services within that organization. And it's very important if we're moving toward cultural competence that we impact each of these levels. It's not sufficient enough for someone to be a culturally competent practitioner because it's very difficult to do so when you're not supported within your organization with policies, procedures, and practices.